最近我们全省所有的挂号费都下调了。
Recently, the registration fees across our entire province have all been reduced. Previously, a slot to see some nationally renowned experts cost 50 yuan, and now it has been uniformly adjusted to 20 yuan. For an attending physician like me, the price is the same as before, which is 10 yuan. In other words, now anyone can spend just 10 yuan to meet and discuss their condition with an attending physician, someone who had to score high enough on the college entrance examination to enter a medical school, complete 5 years of undergraduate study, 3 years of graduate study, 3 to 4 years of doctoral study, and then 3 years of standardized residency training to become an attending physician. At the same time, by spending just 20 yuan, you can meet and discuss your condition with a top expert in this province's medical field. I think, outside of healthcare, there is no other industry where a meeting is this cheap. You can go ask how much it costs to consult a lawyer for a meeting. How much does it cost to get a haircut, and how much does it cost to have an electrician come fix a wall socket at home? And this still is not the cheapest. I think about those who are clearly not emergency cases but come to register for the emergency department and see a doctor in the middle of the night when we are on night duty. For example, someone's scalp feels itchy and they cannot sleep, so they come at 3 or 4 in the morning to see a doctor. For example, some people get acne or hyperpigmentation on their face and have no time during the day, so they will spend 20 yuan in the middle of the night to register for the emergency department and come find a doctor. At such times, we have to get up in the middle of the night to see them, because we do not have the right to refuse treatment, just as we do not have pricing power over registration fees. Sometimes we have just fallen asleep and are woken up, and to fall back asleep usually takes another hour or two. If, unfortunately, another patient comes just after you have dozed off, then if 3 to 5 such patients come in the latter half of the night, you can basically forget about sleeping. Some people might say, then you are there to be on duty. Who told you to sleep? After you finish your night shift, can't you just go home and rest the next day? Sorry, our night shifts are not the kind where you can rest right after finishing. The next day we still have to work whatever shift we are scheduled for. If we are supposed to be in the outpatient clinic, we go to the outpatient clinic. If we are supposed to do surgery, we still go do surgery. So when you come to see a doctor or have surgery, the doctor treating you is very likely someone who has just finished a night shift and stayed up the whole night. Someone will ask, isn't this practicing medicine while fatigued? Fatigued driving is illegal, so is fatigued medical practice not regulated? Sorry, at present there truly is no one regulating this. And this is not something we junior doctors can control. We are just tiny cogs in a machine, we do what we are told to do, we do not have pricing power, and we do not have a voice. Our sleep quality, mine included, is far worse than when we had just graduated, most likely because of long-term night shifts. The dignity of an industry is related to the value of its labor. But the prevailing social value nowadays seems to be, if you are a doctor, you should not earn a lot of money. This is also why registration fees keep being reduced, so as to cater to such values. Of course, some will say, my life goal is to contribute to everyone, and I will not change my original intention because of how much I earn or because of staying up on night duty. On this question, indeed, benevolent people see benevolence, and wise people see wisdom.
因为我跟我媳妇都是在医院上班的嘛，就说一下我们两个单位的变化啊，就今年的变化。
How are doctors and nurses' incomes now? In one word, miserable. To use a classic saying, it is like an old lady celebrating the new year. It gets worse year after year. Because both my wife and I work in hospitals, let me talk about the changes at our 2 workplaces this year. At my wife's workplace, early this year they directly cut salaries by 30%, which is quite a lot. Then at last month's hospital weekly meeting, leadership directly said, this year the year-end bonus is cancelled. But whether this news is really true is still hard to say. If the year-end bonus is truly cancelled, I think many people at her workplace will definitely choose to resign. Our workplace is relatively better. Starting last month's salaries were reduced by 20%, and so far there has been no mention of cancelling the year-end bonus. But if it is also cancelled, we will probably see quite a few resignations here too. This is the real situation at both our workplaces right now. As for my own income status now, I can no longer afford to pay my mortgage. Every month I have to ask my wife for money so that together we can scrape together the mortgage payment. This is the current income situation for an ordinary junior doctor in a general department in my region. Of course, I am not any sort of leader, just an ordinary junior doctor. To be honest, the pressure is pretty high. How would I describe the current changes? I really feel it is getting more and more pointless. There will definitely be many reforms proposed later, like the Sanming medical reform, various doctor compensation system adjustments, etc. But my personal real feeling is, the more the reforms, the worse it gets. The more the reforms, the lower the salary. So sometimes I really feel there is no point. I worked so hard for so many years to become a doctor, and I still earn less than those internet influencers. If one day I truly cannot take it anymore, I might really just resign and stop being a doctor and become a full-time influencer instead. Although this sounds rather pessimistic, the reality is that doctors' incomes now are indeed not what they used to be. Fellow doctors, everyone really needs to be mentally prepared.
我是做了很大的思想斗争才给你们发出来，就在昨天晚上。
Everyone, come and take a look at what I am talking about. I struggled with myself a lot before deciding to post this for you. Just last night, a grandma from the same residential compound as mine went to the county hospital because of back pain. The old lady is in her 70s. She went up and down to get an MRI, a brain CT, liver and kidney function tests, and had her blood and urine tested. Altogether, it cost a little over 1,000 yuan. In the end, the doctor said all indicators were normal and there was no problem, and finally prescribed 2 medicated plasters. How much did those cost? 6.3 yuan. Since childhood, our teachers have taught us to love our angels in white because they save lives and heal the wounded, and they are the most beautiful people in the world. In the 1970s and 1980s, our country was not wealthy, and there was no money to reimburse us. If you had a headache or a fever, you took aminopyrine. If you coughed, you took licorice tablets. Back then, I felt there was no illness that the doctors in our village could not handle. Now national policies are better. We have medical insurance and cooperative medical care, and in rural areas reimbursement can even reach 80% to 90%. But the more this is the case, why do ordinary people instead feel that seeing a doctor is getting more and more unaffordable? You pay for a blood test, you pay for a urine test, you pay for an ECG, you pay for an EEG, and you pay for an MRI. I just want to ask one thing. Aren't these devices things that hospitals are supposed to be equipped with for patients? It is like when I go to a restaurant to eat hand-pulled noodles. It is normal for me to pay for the noodles, but for your back kitchen to buy pots, knives, and stoves, do I also have to foot the bill for that? In the past, when you saw a doctor, they would say, open your mouth. They would check your tongue, look at your throat, feel your head, press your abdomen, and take a careful pulse, and in 8 or 9 cases out of 10, they could figure out the illness. And now, I go to the hospital, and without even raising their head, they tell me to go get tests first. Please at least raise your head and look at me. I am a man or a woman. Am I a living person or a dead person? You do not even know. Overall, our country's medical reform has been very successful, and ordinary people recognize and praise it. But in the implementation stage, I hope it does not go off track or get distorted, and that we do not add even more financial burdens on ordinary people.
So as you can see, the issue of doctor salary cuts is not a problem of one specific hospital and not a problem of one specific department. It is the entire industry being squeezed. Why are hospitals cutting salaries? Because their revenue has decreased. Why has the revenue decreased? Because people really are not going to seek medical treatment now. It is not that they're not getting sick. It is that they do not dare to spend money. In the past, when people had a minor cold, a slight fever, or some skin problem, they would go to the hospital. Now what do people do? If they can hold on, they hold on. If they can endure, they endure. They drink ginger water or buy a couple of pills and get by. Go to the hospital? A blood test costs several hundred yuan, and imaging can cost several hundred yuan again. Tell me, can ordinary people afford that? So when there are fewer patients, the hospital's revenue naturally decreases. When revenue decreases, performance-based pay must be lowered. Once performance pay is lowered, doctors' income goes down along with it. When doctors' income goes down, their emotions go down, and their motivation goes down. Many people always say things like doctors should have professional spirit, and saving lives shouldn't involve talking about money. But we must understand, doctors are human too. They need to eat, they need to support their families, they have mortgages and car loans. You let someone who studied for more than 10 years, works night shifts constantly, and can be held responsible for medical risks at any moment, earn less than an ordinary white-collar worker in another industry. Who can withstand that? So I believe it is not that doctors cannot endure anymore. It is that the income level of the whole society cannot endure anymore. Ordinary people cannot afford treatment. Hospitals lose money, doctor salaries are cut, doctors become exhausted, medical service quality declines, ordinary people become even more afraid to seek treatment. Once the cycle begins, it only goes downward. Tell me, who can win? In the end, this is not someone's personal problem. This is the problem of the era. When people's wallets tighten, hospital revenue tightens, and doctors' expectations for the future fall. So, the salary cuts for doctors and the fact that ordinary people cannot afford medical treatment may look like two issues, but in reality, they are one and the same. People simply do not have money. All right, that's all for today's sharing. If you have any thoughts about this topic, you're welcome to talk with me in the comments. We'll see you next time.